Hi, everyone. Welcome to the CURES show, where we explore the cutting edge of wellness for our mind, body, and spirit. We all know about long COVID, brain fog, fatigue, memory loss, so many of the symptoms associated with long COVID. And new research now reveals that reduced levels of serotonin might explain some of those lingering symptoms. Joining us now to talk about this is a true expert, Dr. Ulysses Wu, Chief Epidemiologist and System Director of Infectious Diseases for Hartford HealthCare. Thank you for being with us, Doctor.
Thank you for having me back.
So we've talked to you throughout the pandemic and all the different phases, and now there are so many people, I think most people we know have experienced COVID on one level or another. Many people have had it more than once. And then there are those people who are really struggling with long COVID. What do you think of this new research that says it might be affecting serotonin, and that it could be why we're feeling depressed or brain fog or all the things that people complain about with long COVID?
Yeah, it's certainly an interesting study because really the pathogenesis of COVID, of long COVID, I should say, or post-acute COVID syndrome, it really hasn't been elucidated at this point. And so this is certainly one of those theories, and that the theory that depleted serotonin levels within the body could contribute to some of these long COVID symptoms, maybe not all of them, but some of them is certainly intriguing.
Yeah, and do we even know yet why some people have long COVID and others don't?
No, and we certainly don't. And even going back before that, we don't even know why some people don't get COVID at all, and some people, experience it repeatedly. The one thing that I will say about COVID is that they're hoping that they can extrapolate whatever they learn about long COVID or post-acute COVID syndrome to other viral diseases, because it is known that people who experience other respiratory viral diseases or other viral diseases may also be subject to something very similar. But it was that COVID brought this to light for this long syndrome that people may be experiencing.
Yeah, and just to bring people up to date, and you can fill me in if I'm being too simplistic, but this was a study where they looked at people, and they looked at people who didn't have long COVID symptoms and people who did, and they found that their levels of serotonin were lower. And that is a neurotransmitter that really can affect our mood, our memory, our sleep, right?
Yeah, so serotonin certainly is our happy transmitter, and there are certain things that could boost serotonin. They looked at mice models with the serotonin levels, and it turns out that the theory is that there's chronic inflammation that could be due to viral persistence in the gut. Now, I've always said that the gut is kind of the window to our soul at this point. And from an infectious disease standpoint, we've always known that there's probably 60 to 100 trillion bacteria in and on our body at any given moment, or microorganisms, including viruses. And a lot of it resides in the gut. So if there is persistent viral replication, what we call a reservoir that lives within the gut, what it is possibly doing is it's inhibiting tryptophans, which we all know, like Thanksgiving is coming up. So with turkeys, right? So we eat a lot of turkey, we get sleepy because of tryptophan. And it's funny, or it's not funny, it's coincidental that serotonin helps regulate mood and sleep as well, but it may impair tryptophan absorption, which would lead to decreased serotonin levels within the body.
And if you do have decreased serotonin levels after long COVID, how would you feel? What are some of the things that would manifest as?
Well, and that's the thing that we have to really look into, because a lot of these symptoms that people have are also non-specific. So they could be due to other reasons. But the stuff that we've touched upon: impaired memory, impaired sleep, impaired cognitive ability. So with long COVID or post-acute COVID syndrome, there are psychological and neurological effects that it may have on the body, but there are also other physical effects. And so there may be shortness of breath, there may be cough, there's cardiopulmonary issues. And so it's multifactorial, and they're still trying to figure out, does serotonin really tie into the physical symptoms as well? Does it tie into the neurocognitive symptoms? Does it tie into both, or does it not tie into either? I think that still needs to be figured out, but it's certainly interesting research that has been done so far.
Yeah, I'm just looking at this. It says researchers analyzed the blood of 58 patients who'd been experiencing long COVID for up to 22 months. Those results were compared to those of 30 people with no post-COVID symptoms and of the 60 patients who were in the early stage of the virus. The analysis said that serotonin levels were altered right after the infection, something that also happens with lots of other viruses. But in people with long COVID, serotonin was the only molecule, according to this study, that did not recover to pre-infection levels. So I'm just reading from the analysis there. What do you do about that? If you might be one of those people going, yeah, I think I'm much less happy and much less energy and all of that, and I might be suffering from this. Do you talk about an SSRI or what's the next step?
Well, so here at Hartford HealthCare, we actually do have a long COVID center where we've been able to refer patients to that may be associated with disease. And I think I don't know whether an SSRI is the answer. Certainly, logic dictates that that could certainly be something that they're going to study and that they're going to look for to see if it actually does make a difference. At the Hartford HealthCare Long COVID Center, they do take it in a holistic model. So they don't just look at, your cardiopulmonary symptoms or your gut symptoms or your neurological or cognitive abilities. They look at everything and they look at what may be affected and what I guess what's the best way to say it? What treatment will direct where you're going to be affected most deficiently. And so an SSRI may be another tool in our armamentarium that may help, especially those with neurocognitive disorders or those that may have psychological sequelae from a post-COVID syndrome.
Yeah, and actually, I'm just reading now that Dr. Levy, the lead author and assistant professor of microbiology at the Perelman School of Medicine, said they are planning to do a clinical trial next to test fluoxetine, which is an SSRI. People know it as Prozac. So I guess we don't know yet, but that's the next thing is, I mean, the question that so many are, how do I get better? And so I guess this is one of the studies that could lead to some answers.
I think so. And certainly it is something that certainly warrants a lot of study. And even if it does help, there are other aspects of long COVID that I think need to be addressed as well. And so I would make sure that even if this is something that works for people, that they also focus on the other areas that may be affecting them, where maybe this drug alone may not be able to help as well. So I think this is an important part of the arsenal that hopefully these studies will bear out some help.
And we have done other shows on this about the importance of healing our gut after COVID, after really anything. But I want to go back to what you said, that the gut is really the window to our health and to many other things. A lot of people don't understand, like, why does it matter what's going on in my gut that's affecting my brain? Can you talk a little bit about that in layman terms?
Yeah, I'll even take it away from the brain, but they think that so what lives in your gut is this 60 to 100 million or million, sorry, I've done a disservice, trillions of microorganisms that really regulate they interact in a complex way to create basically your overall health. Now, we're talking from a psychological standpoint, but it is believed that there could be autoimmune diseases that could be triggered from a change in your gut microbiome. We've seen things like a lot of things that, or yogurt or kimchi, fermented foods that we use to try to replenish our gut. And they've looked at studies, they've looked at a Western diet compared to somewhere else in the world. And they've shown that our microbiomes are not as diverse in our gut in a Western diet. And a lot of that is because of our processed foods or a lot of the foods that we eat. It's much lower in fiber, it's much lower in vegetables and fruits, and a lot of these things that may contribute to what we call, quote unquote, the healthy gut. Now, from an infectious disease standpoint, we actually have a very tangible disease that results from when we deplete our gut bacteria. And one of these diseases is called Clostridioides difficile. It used to be called C. diff or Clostridium difficile. And that's a terrible, potentially life-threatening diarrhea associated when you take antibiotics. And so when that antibiotic affects that gut microbiome, it allows the bad proliferation or the proliferation of bad gut bacteria to actually expand and grow and causes this disease, C. diff, Clostridioides, which is actually a microorganism that lives in a lot of our guts. And so that's actually a good example of when you ruin the peace, or when you kind of stir the pot in your gut, that this is one of those diseases that it can lead to. And I think there are going to be triggers, whether it be serotonin, whether it be depression, whether it be autoimmune diseases, even possibly asthma. I think these are all diseases that are going to, hopefully in a couple of years, the gut microbiome will be tied into. Cancer would even be another thing that they're going to look at,
Yeah, I mean,
or already are looking at, I should say.
right. And so many folks might be thinking, well, I thought that just is indigestion. I don't have that problem or whatever. This is really the fact that so many of our neurotransmitters are actually manufactured in our gut, and we have our gut-brain axis. So the idea that we need to heal that superhighway that kind of goes back and forth would make sense, even from the medical model of infectious disease.
Yes, you're absolutely right. And I think, you may not, if your gut microbiome is not diverse, I don't think you're going to feel anything tangible on a day to day basis. But sometimes something may feel off. And I'm just hypothesizing at this point. But you may not feel right. But that could be due to a lot of different things. And so I do believe that restoring a healthy gut microbiome could really, I don't want to say cure what ails you, but certainly contribute to your overall health and make you a healthier person.
Yeah. And if people want simple things, I'll just refer them to, we've done other podcasts on this with some functional docs and naturopathic doctors who often talk about the anti-inflammatory diet. And sometimes there might be supplements like probiotics that we really need to add in. But these things aren't really that different from, I know you're in the world of infectious disease, but the idea of working together, that we understand we're like a holistic being. And when we get a really bad virus, we can be off, and we might need to really work on restoring ourselves or preventing immune problems by healing our gut.
Yeah, absolutely. I mean, basically, you hit the nail on the head. We live in a time where our body needs to achieve homeostasis, right? It needs to get to a point where it is most comfortable. And anytime you disturb that homeostasis, it can certainly put things out of whack. I remember a study that was published, and it was shown in the New York Times. Do you remember Pigpen? It's funny, when I talk to most younger people, they don't know who Pigpen is, from Charlie Brown. And if you remember him, Pigpen from Charlie Brown, he had this cloud of dirt and dust that
Oh, yeah,
always surrounded him.
Yes, I do. I forgot that was his name. Okay.
Yes, his name. He was the bass player in the Christmas special. If anybody remembers Charlie
Okay,
Brown
yeah, yeah.
Christmas special, the double bass player. But anyways, long story short, they were able to tag this cloud in people, and they were able to look at them and see that we actually did have a cloud, this Oort cloud of bacteria and microparticles that actually surrounded us, and that can be disturbed. And actually, when you cohabitate with other people, or even dogs or cats who have their own clouds, within 2 weeks, you start achieving that homeostasis and you start having the same clouds. I thought it was very fascinating and very interesting, but it kind of goes to show that we are a very diverse it's machine that is not just our skin and our bones and our blood, but there's a variety of microorganisms that certainly contribute to our overall health.
Yeah. And that's important, because I know so many people are like, don't you have a pill? Don't you have, and you work with some really great medications. But the idea, when you're dealing with something like long COVID, this is really a systemic thing. So this is one study showing how we could be affected by this and maybe, hopefully, get some solutions. But in general, when you're talking about stuff like this, it's not always like, take a pill and you're good.
Yes, we have become a society where we do expect kind of immediate results, right? And we kind of want it in pill form. And medications certainly are life saving, and they've certainly done a lot of good in this world. But I think it is a small piece of the picture where we not only need to have the medications that help us and make us better, but we holistically need to evaluate ourselves. And we talked about things like probiotics. I'm a big fan of food. Food is gut health, and we talk about yogurts or kombucha, kimchi, tofu, things that are fermented that also contribute to your gut health as well. And that is just part of your overall well-being. But I'm certainly not going to discount how drugs work and how well they work, but it is a piece of the larger puzzle.
Well, and interesting because you have a perspective where I know during the pandemic you were watching what was happening all over the world. And you mentioned the Western diet specifically, we don't tend to do as well with all the processed foods. I'm not saying everyone eats that way, but a lot of people do. What about in other parts of the world? Are we seeing less long COVID or in places where they eat more of the Mediterranean diet or more seafood or less processed foods?
It's a great question, and I don't know the answer to that because for two reasons. I mean, it's certainly thought that maybe there would be a decreased incidence of this in other parts of the world, but a lot of it is also reporting, right? And
Yeah.
so a good example is COVID rates are probably up right now, but a lot of people just aren't testing it, aren't getting tested, and so it's not being reported. And so I don't know if it's happening less in other parts of the world, whether it's because it actually is happening less or it's just not being studied or being reported.
Okay. If someone's suffering from long COVID, I want to reiterate that you say there is a place at Hartford HealthCare, but if someone's listening and suffering from long COVID, what would you recommend for them?
The first thing is that we always say don't lose hope, don't lose despair. So or don't despair, don't lose hope. And so the median average, it depends on what study you look at, is that a lot of people do get over their long COVID syndromes eventually. The definition of post-acute COVID syndrome is that any symptoms that may be lasting over 4 weeks. And within a couple of weeks, maybe 2 months, the majority of people have gotten better. But that doesn't discount the end of the bell curve where there are people that persist maybe up to 6 months, up to 9 months, even past a year at this point. And so I don't want people to lose hope, but the good news is that a lot of these symptoms do go away. Now, that's not much solace to people who still experience these symptoms after months, maybe after even greater than a year at this point. And I don't want to say that's the time to seek, additional help, whether you see a cardiologist, a pulmonologist, a psychologist, or a neurologist. Hopefully you've talked to people during this time or you've been referred and you've seen people sooner. But I think there are options to, if not take away the long COVID, kind of decrease the effect that long COVID may have on your mental, emotional, and physical well-being.
And anyone can just go to the long COVID clinic at Hartford HealthCare, or how do we get involved in that?
Well, so I don't have the information offhand, but certainly it is on our website. And a referral from your physician, it doesn't have to be your primary care, from any physician or practitioner. Certainly, they can see these. They can see the patient when the referral is made. So the
Okay.
opportunity is there.
Yeah, so Hartford HealthCare has a great website, so just referring people locally. And I think it is probably a good wake-up call. We talk about COVID a lot, but you deal with all kinds of infectious diseases. There have been other viruses, right, where people take a long time to recover from, maybe sometimes the flu, mono. I mean, this isn't just unique to COVID about what happens after and how we might need to rebuild.
Yeah, that's actually a very good point. And so one of the examples I use is that before COVID, there were a whole bunch of respiratory viral diseases that were affecting us every single year. Influenza was a good example where we would have 40 to 50,000 deaths in the United States alone, potentially in a given year. And it really didn't get that much press until COVID happened. And now what COVID is doing is, no pun intended, shining a microscopic light on some of the other microorganisms that certainly has affected us. And I brought to a good example before that, there may not just be a post-COVID viral syndrome, but there may be a post-viral lung syndrome that's associated with other things. And so things like influenza, you've heard of parainfluenza, adenovirus, RSV, are these all things that can trigger diseases within our body? EBV, you brought up, is a good example. The majority of the American population is exposed to EBV in our younger years. And most of us get over that. So is the question, is there a latent reservoir for some of these diseases like they are suspecting in the gut for COVID, or does it really make us stronger? That's one of these things that we still need to really figure out at this point.
Yeah. So let's go back to the basics of, a lot of people are, you're right, we were all testing. I had COVID before the vaccines came out. I was pretty sick. I had COVID after the vaccines came out, less sick. My whole family's had COVID. I mean, a lot of us have been through this, if not once, maybe a couple of times. there are boosters, there are vaccines right now, but there seems to be less of a message, even as I ask my own doctor or people asking their own doctors, like, do we get it? Especially like, let's just say you just tested positive or you thought you had COVID a couple months ago, maybe you don't need the booster. Does it work at all for long COVID? Should you not get it if you have long COVID? That's a lot of questions, but let's take one at a time. Like, should you be getting the vaccine if you're an adult right now for the boosters?
Yeah, I do think you should get it. And one of the good things about this current vaccine is that we were expecting demand to actually be low, and it's actually been very high. And so a lot of people have been getting. We're not calling it the booster anymore. We're just calling it the vaccine, and
Okay.
you're trying to get it to, well, I mean, some people are calling it the booster. So what the nomenclature actually will be sorted out. But they're calling it the 2023-2024 vaccine, which means that they're anticipating this to be a respiratory vaccine that maybe we can get on a yearly basis. And demand has actually been very brisk. You've seen anecdotally in the media that long waiting times, or there haven't been any times where people can get the COVID vaccine because of the demand at this point. And so that's very different from the booster that we experienced, over a year ago, where booster demand was actually fairly low, probably in the 20s to 30s at this point. So the good news is that people are out looking for it, and there are multiple reasons to do it as an adult. Number one, can it protect you from long COVID? Well, the study is that I don't want to say there's been a definitive study, but there is the thought that it could actually protect you from long COVID. It may actually even protect you from getting COVID as well, even though its main job is to really keep you out of the hospital, keep the COVID from getting worse. It may also protect you from spreading it to others. And so there are multiple reasons to actually get the COVID vaccine. Those are just a few of them.
Okay. And what if you've already had COVID like once or twice? A lot of people are like, I don't need it anymore. I'm immune.
Yeah, so it's one of the things that long COVID, a lot of the long COVID studies actually had to deal with the previous variant before Omicron. So Delta being one of those variants. And so I think long COVID and Omicron certainly needs to be studied going forward. But that being said, it still does reduce your risk. And even if you've had COVID, they've actually said the best immunity are those who have actually had COVID and those who get the vaccine. Those are the people who are the most, I will just put in air quotes, super immune at this point. Now, if you've only had the vaccine and if you haven't had COVID recently, I'm not recommending you go out and get COVID to make yourself super immune. Your vaccine should actually be sufficient. But for those who have had COVID recently, you can get your COVID vaccine fairly quickly as long as you've resolved, most of your symptoms are resolved. But they're saying because of your immune system, what your immune levels are, they're actually, there's no recommendations. I shouldn't say recommendations, but they're saying maybe you want to wait 90 to 120 days after your COVID illness because you have some protection, and then you can get the vaccine 90 to 120 days and get a little bit more protection at that time.
Okay. What about kids? If the same, would you give them the same advice? I mean, kids we've seen don't really seem to get as sick or end up in the hospital. So some are saying, I'm not going to get that vaccine for my kids. Weighing risk versus benefit, I don't like the idea of it. I'm not sure, it's kind of still a newer vaccine, people will say. So I'm just going to let my kid be the kid.
It's a great question, and it's not something that I can easily answer. So kids, unfortunately, do also, some of them do get long COVID, and you're absolutely right. Looking at the bigger picture, people are they doing better with this variant? Are they doing better with Omicron? Absolutely, but it is still not completely a benign disease. Everybody's saying, "Oh, it's just the common cold at this point." Unfortunately, we're still seeing deaths across the country. We're seeing them in Connecticut, whether it be due to COVID itself or complications of COVID, and they have comorbid syndromes. And so, what I will say, and I know it is controversial, it is a safe vaccine. And so, if you have the ability to get a safe vaccine and protect yourself from it, then I would say that it makes sense to get it. But I know a lot of this is individual choice at this point, and it's really up to the parent and the kid themselves to really understand what their own risk assessment is and what they desire out of a vaccine, because I know it's different for everybody.
Okay, and now I'll put finally, and we only have a couple minutes left, but where you see this going? I mean, we have a vaccine. Is COVID just going to become like flu? As you look as an infectious disease doctor, we used to talk about flattening the curve. Now it's just kind of there. What's next?
Yeah, we've never flattened that curve to zero, unfortunately. And that means it's probably going to be circulating probably, I don't want to say forever, but there are other actual circulating coronaviruses prior to COVID-19. There's 4 of them that actually give us probably 10 to 15% of our common colds that we ourselves experience every single year. And so the hope is that this does move towards a pattern of becoming that COVID common cold, that it is actually less severe, that it is less lethal, and doesn't kill people, and it doesn't affect people in adverse ways, such as long COVID, whatever it may be. The only worry that I actually have a lot of worries, but the main worry that I have right now is the variants, right? Is there mutation that all of a sudden this will change? And we saw that with some of the previous variants, the last one being Delta, where it was a very dangerous virus, and it unfortunately affected a lot of people in a dangerous way. So that is the one thing that remains to be seen. Will it decide to all of a sudden become more virulent, become more dangerous with its future mutations? That is the worry down the road. So I don't think we're out of the woods, but that remains to be seen.
Okay. The other reason people might not be getting vaccines, besides they just think maybe they don't need it, or they're nervous, or, oh, is this vaccine going to keep up with it? The other reason might be that, hey, I got a really bad reaction last time. I was sick, I had a fever, I missed a day at work. I was one of those people, and I remember you saying, hey, I'm jealous. I wish I had a response like that. You know, it's working. I expected that. I knew I might get a reaction with that vaccine, so I had to plan for it. Are we seeing that with the rounds of vaccines now? Are people still getting ill from them and needing to kind of just take a day or two off?
It's a good question, and anecdotally, I haven't actually heard very many changes, if anything. If anything, I've heard maybe less reaction. And so, yes, I am tongue-in-cheek jealous a little bit because I've not really experienced a reaction with my vaccines, and I'm getting ready to get both my flu and COVID vaccine. But it does bring up a good point. So I will actually go back to the flu vaccine. A lot of people's like, oh, I got the flu vaccine and I got the flu. It is impossible to get the flu from the flu vaccine. The reason you actually probably felt bad is either number one, you got the flu itself, or number two, what is more likely, it does take a while for immune system to ramp up. And most people get the flu shot during flu season, and they actually got the flu.
Yeah.
And so with COVID, I don't want to wish a reaction on anybody, but I guess if you want to make lemonade out of lemons, if you have a reaction, it means your immune system is ramping up and getting ready.
Okay. All right. Well, we are out of time. Dr. Ulysses Wu, thank you so much for being with us. I hope that this serves you if you're suffering from long COVID with some ideas of how to move forward. We appreciate your time in being here, Doctor.
Thank you for having me again, and I wish everybody good health.
Yes, absolutely. Have a great day, everyone, and be well.